everybody. As you guys come in, you guys know the routine. Do me a favor and let me know what city and state you are watching from. As you come in, let me know what city and state you're watching from. Also, let me know where you are in your journey. Are you in school? Are you in school to become a medical assistant? Are you thinking about becoming one? Are you already a seasoned medical assistant? Where are you in your journey? Let me know as you come in. And as you guys are doing that, I'm going to just go ahead and say this really quickly. I'm not going to be on here long because I am literally on my battery is on 35% and I don't want it to go dead. I can't put it on the charger while I got it sitting up here. But anyway, I want to talk about manual blood pressures just really quickly. And I want to remind you guys, listen, as a medical assistant, you have to know how to check manual blood pressures, okay? I cannot tell you how many times I've seen this, and this is what sparked the video, okay? I cannot tell you how many times I see people saying, don't worry about it because you have the blood pressure cuff. You have the automated machine, right? I hear people say that. My students have said it. I've seen people in my group say it, even in the comments, okay? Even my blood pressure video. Side note, if you struggle with blood pressure, if you haven't already seen my blood pressure video, make sure you watch it. But listen, guys, as a medical assistant, you need to know how to check manual blood pressure. And it's okay. Somebody said, I'm sorry, second manual blood pressure. And I'm glad that you are admitting it. Anybody else that struggles, listen, I struggled with it too when I was in school. I get it. And when I was a new MA, I get it. But you got to practice, practice, practice. I'm giving you guys an assignment. You don't have to turn it in, but I'm giving you guys an assignment. If you know you struggle with blood pressure, I want you guys to commit to practicing on at least three different people a week, okay? Especially if you're in school or you're a brand new MA, you don't have a job yet or whatever. I want you guys to commit to practicing on three different people, at least three. If you could do more, even better. But I would have my students do a log, and they have to do three different people because the more you practice, the better you get. First of all, you need a good stethoscope that you can hear out of. Okay, now I have some in my Amazon store that I recommend. They range anywhere from a $25 set, blood pressure cuff and stethoscope set, up into $300, $400, $500. The Echo ones, right? So and then you have the ones in the middle that's affordable, but they're still great quality. All right. But anyway, I wanted to talk about this because so many of you guys, like I said, between my group, even these comments here, even I seen some on here on YouTube as well. You have to know, even though you have a blood pressure machine automated cuff, if your patient's blood pressure is abnormal, you have to check it manually anyway. If it's too high, if it's too low, you got to check it. And also, there are some providers who only wants a manual blood pressure. Okay? You got to know how to check manuals. There's no way around it. So if anybody else struggles with it, practice, practice, practice. Do me a favor, guys. If you're enjoying my content, make sure you guys subscribe, like the video for me. Not going to stay on here long, but let me see what you guys are saying in the comment. From Utah. Okay, Dallas, Georgia. I didn't even know that. Wow, I did not know there was a Dallas in Georgia. Wow. Season CMA. I know that's right, Tamala. I just finished school and I take my exam on the 29th. Good luck, Cecilia. Just accepted an MA job. Oh, accidentally. Just accepted, where to go? Just accepted an MA job for internal medicine. Congratulations, Erica. Oh, the Bradley family said, I'm so glad my teacher pushed this on us. Yes, I'm glad too, the Bradley family, because it's at the least, right? Make sure you have your blood pressure's on point. So guys, get a blood pressure cuff and stethoscope set if you don't already have it. On Amazon, they are $25, okay? $25. And practice on at least 20, I said at least 20, I'm sorry, at least 3 people a week. If you could do more, even better. 3 different people. And the reason why I say different people is because you want to get used to actually checking your patients. Because if you check the same person over and over, you want to get used to it. You want, and then you'll all start being able to almost estimate their pressure. You want to do 3 different people. Some people, they have a stronger heartbeat. You'll be able to hear better. Then you have some people who have a faint heartbeat. You want to be able to hear it as well. Okay. So yeah, I just wanted to mention that I'm not going to stay on here long, guys. Hello, Miss K. I'm trying. Hey, Tori. You got this, Tori. You got this. Just keep practicing. Get the cuff set if y'all don't already have it, y'all, and just practice on 3 different people. A spouse, a child, a sibling, a friend, cousin, aunt, whoever will allow you. Oh, especially if you have someone who struggles with high blood pressure. Listen, they could be your regular patient. Sometimes I have students and they're like, my mom has high blood pressure, and so I like keeping track of her pressure. So that's even better if you know somebody. Oh, okay? Tori says she got the set from my link. Yeah, guys, I have it in the description box. My Amazon store. I have the cuff and the stethoscope. But guys, stop avoiding those manual blood pressures. I know y'all do. I know y'all do, because I've worked with some that do, and I've had students that do, and I see y'all in the comments on here and on Facebook talking about, oh, you don't need to know how to do manual pressure, and you got the cuff. On my video, somebody said that. Why do I need to learn this? It's the old way. No. No, it's not the old way. It's the accurate way. Manual blood pressure, if you check it correctly, is always going to be more accurate. If you can hear it clearly. Now, there are some cases where some patients, they're so faint, you just cannot. And in that case, yeah, if you check it on the machine, it's going to be better, right? But if you are checking your blood pressure correctly and you can actually hear it, and you have the cuff on correctly, your blood pressure cuff is calibrated, you're going to get the most accurate reading. This is why the provider is going to want you to check it again if the machine reads too high or too low, because they want you to check it manually to verify. This is why they have you check it manually, because that's how you verify. That's how you get your most accurate pressure. Do you have the pre-exam quiz 2025 CCMA? There is no 2025 CCMA. It's still the same. And the reason why I'm making sure I address that is because I get a lot of people asking, are these videos for the 2025 CCMA? It's all the same. What happened in 2023, they did update it and they added some content, but all of the videos still apply. It doesn't change. If anything, they update sometimes the numbers, like the lab ranges, like what was it? One of them, hemoglobin. One of them went from or was it hematocrit? Don't quote me. I don't have the numbers. I haven't been going over this information in a while. One of them went from 17 to 18. I think it was oh shoot, I can't remember which one it was, but one of them. So it's like a very it's certain changes that you wouldn't even notice, right? So but when you have things like the diagnosis codes, CPT codes, things like that, that stuff don't change. It's still the same. Medical terminology doesn't change. Like I said, the numbers may be 1 or 2 more, 1 or 2 less, but that's about it. Everything else doesn't change. Cardio still means heart. Let's see. You were suggesting in my class who all passed. Congratulations. You are so welcome. I have a phone interview with a medical clinic and I just finished school. I am not. How do I ask for realistic pay? I'm not certified, but I have my BLS and certification. Oh, that's a good question. How do I ask for realistic pay? Now, I will say this, guys, and this is for anybody that's wondering, because in my group, I often get how much do MAs make. I will say this. It depends on where you are. We know that medical assistants as a whole, and I always say this, medical assistants as a whole, very much like teachers, are generally underpaid, right? We know that generally underpaid. Some are not. Some of us do, do well, but generally, right? It's a profession that is underpaid. So I will just first say this, it depends on where you are, cost of living where you are, certain areas. So first of all, consider that. And then 2, consider what they start off with. So realistic. So let's just say, I'll just throw a number out there. Let's just say you want 20, right? But this organization that you're applying for, they only start their MAs. They're not going above that. They're going to start you at $17, right? So if you know you want 20, then you know, okay, this is not the company for you. Now you have some that may negotiate with you. They may say, okay, 20 is a rate that we pay our MAs. However, you have to have experience, right? And then you may say, okay, well, I'm certified, I got this, I got that, so you can kind of negotiate. But then when you have those places that's just a hard, this is what we pay, $21, this is what we pay our MAs, but you want 25 and 21 is their max, right? That's not the place for you. So that's one thing to think about. Another thing is to really hone in on your experience outside of medical assistant. If this is your first job, right? And as you just said, you just finished school. So if this is your first job, you're going to have to really highlight the other areas in which you have worked in customer service, right? That can relate to working with patients. So like if you worked in any type of customer service job where you've had to deal with people and customers, you can relate that. If you are trying to work in pediatrics and you've worked in daycare or you worked at a school with kids, that's a good way to kind of translate those skills. So that's some of the things you want to do. So realistic as in knowing what the company pays versus what you want, knowing what your area pays versus what you want, and then really honing in on why they should pay you that or why they should hire you in the first place. And guys, be able to answer the question, why should we hire you? I need you guys to really work on that. If you don't already know why they should hire you, I need you to find out. Find out and learn how to articulate that. And sometimes people are looking for the right thing to say when it's really just about just saying who you are. You know, my name is, I'll just use Cecilia because she's and that's one of my aunt's name, by the way, Cecilia. My name is Cecilia. I'm a brand new medical assistant. I just finished school at Fortis College. I had a 4.0 the entire time I was there. While I was there, I learned how to draw blood. I learned how to perform EKG and phlebotomy, you know. So just think about, you know, when they say, tell me about yourself, that's actually what I just answered. Tell me about yourself. And then also be able to answer, like I said, why should they hire you or why you're the best person for the job. Somebody said they like my necklace. Guys, this is on my site, Shop with Ms. K, MIZZK.com. It's the stethoscope necklace. You can add the name that you want on it. You can add it in the note section of the shopping cart page. But these are on my site. It's shopwithmizk.com, MIZZK.com. Shipping is longer now. I actually ordered a necklace for one of my coworkers, and I need to check with my vendor to see what's going on because shipping takes like 14 to 21 days. And so I need to check with the way this shipping is going on right now. It's just taking even longer. It's been 5 years. How much has the exam changed? Not much, not much. As I mentioned, I don't know if you heard it, Tamala, but it doesn't change much. Maybe a number or two. Like I mentioned, one of the blood work examples was like 17 and now it's 18. Stuff like that doesn't change much. Everything stays the same. They just updated and add more stuff. So like we were in a pandemic, so they added more content about telemedicine, right? So if you guys are ever wondering about my videos, my older videos, and if they apply, just know that yes, they definitely apply, but definitely make sure you watch the newer ones because I may cover something in the newer ones that I didn't in the old ones. But absolutely, the old ones still apply because all of that is still on the test. Congratulations, Love Jones. You're welcome. Okay, I'm gonna one more question, please. Should I ask what they pay or bring it up? Oh, not in the interview. I wouldn't. They're not. It's not on their site or the job posting. Let them. It's always, that's always been one of those questions that's just on the do not ask list when it comes to interview. Like, how much does this pay? Now, if they bring it up, they probably will. They will probably bring it up. Most of the time they do. Well, I'm not going to say most, but a lot of times they will bring up the pay. And sometimes you won't know until they make the offer. Okay, so it's hard to say, but no, I wouldn't ask how much it pays. I would look at the site. Oh, another thing, you know what y'all could look at too? What is it called? Glassdoor, like those websites. I think it's Glassdoor, where you can see reviews from actual former employees. So that's an option as well. And you can kind of get an idea of how much they pay, because they're former employees, I'm sorry, not employers. But try sites maybe like Glassdoor or like other sites where employees are actually talking about the company. I don't know if you guys heard about those sites, but instead of it just being about the patients and their experience, it's about the actual employees and what they experience. One thing too, I want to say, when it comes to interviews and all of that and getting a job, make sure the company is the right company for you guys. Don't be so desperate for a job that you just want anything. You just want money and you're willing to take anything. When you're going to these interviews, ask questions, okay? Make sure it's a right fit for you, a good fit for you as well, okay? So research these companies. Miss X said, I'm going through your study guide now. It's comprehensive and thorough. Thank you for sharing that. As you guys can see, Miss X has my study guide. If you guys are interested, it's marefreshercourse.com. If somebody can put that in the chat for me, I would appreciate it. www.marefreshercourse.com. I've been getting excellent reviews from that. It's modules, and then there's a quiz at the end, and then practice tests. If anybody is on here and you have my quiz and you have my study guide, leave me a review in the comments. Let me know how you like it. If you need a quiz reset, just email, what is it? Kendra at mawithmissk.com. The email that you get, the email that your correspondence come from, you can just reply to it and ask for your quizzes to be reset. This is off topic, but I wanted to thank you for the material. Oh, that's not off topic. You're welcome, Melanie. Congratulations. I took the CC. Okay, I failed. You're gonna have to hone in on your areas where you fell short. So anybody that just recently failed, make sure you look at your score report and go over the areas where you fell short, and then look at my study tip videos. If anybody's here for study tips, go to my playlist and look up study tips, because I'm not going to go over them in this video, but go to playlists and study tips. No, on Indeed. Okay, on Indeed. Okay, gotcha. So yeah, it's not on it. So just try those sites like Glassdoor. Hey, Gigi. Hey, Jasmine. My moderator's in the building. Hey, Jasmine. I need a job ASAP, but everyone requires experience. Just finished CMA program. I even handed out my, to different. Yeah, it is a thing. Yes, it's going around to those clinics. That's a full-time job in itself. I've been there. Trust me, I get it. It is, something is going to go through. Something is going to come through, Athena. It will. Try some medical assistant recruiting agencies in your area. Make sure you check in Indeed. And then also, yes, continue to go to some of these offices, and somebody's going to call you. Somebody's going to call. I had an experience back in 2013, and if you want to hear about it, I have a video on my channel, and it's called How I Got Humbled as an MA. And I don't want to get into it in this video because my battery now is on 29%, and I got home. I haven't showered yet, so I'm about to go shower and all of that, but it's called How I Got Humbled as an MA. And I talk about that and how I was going. It was at least 100 clinics that I sent my resume out to. Well, actually physically gave my resume to. And I just shared that little journey and how I kind of got big head. This was back in 2013. I had been teaching and I had this experience, and I just thought I was just the cream of the crop, okay? And just got humbled, right? And literally, God literally humbled me and like, girl, you ain't nobody. So yeah, and ever since then, it's really like it grounded me. It really grounded me back then, because I was young. I will say that. I was like 24, 25, literally 24, 25, and thinking I was a cream of the crop. And God was like, girl, bye. Can we reach out? kheart.cpr@gmail.com. KHEART@gmail.com. Yes, Jasmine, I think I do remember you saying you passed, but congratulations, just in case I did not already congratulate you. Congratulations, Samantha. Everyone does machines now, and I think I've done one. Yeah, maybe, yes, but still make sure those skills are up to par. And this is exactly why I wanted to address this. No weapons shall prosper. Amen to that. But this is why I wanted to address that, because a lot of people feel like because we have machines, they don't need to know how to do it. But just because you don't do it every day don't mean you don't have to. Because if you have a low reading, an abnormal low or an abnormal high, guess what? You got to check it manually to verify it. You don't just let that patient go, oh, it's 170 over 100. No, you check it manually to verify. Because it could be the machine is off, or it could really be 170. Either way, you need to verify and see what that blood pressure is, right? Is it really high? Is it the machine? If it's the machine, okay, we need to get that machine service. If it's really high, that needs to be addressed, of course, right? If it's too low, you done checked it, it's 84 over 50. You got to check it manually to verify. Okay, so always, always, always have your stethoscope at work with you, even though you use machines. Some offices provide stethoscopes for you, but you always want to have your own. Congratulations, Athena. And you're welcome. Gigi says, Miss K, video such a blessing. Thanks kindly. You are so welcome. You are so welcome. All right, guys, let me go ahead and go. I got to go shower so I can get ready to eat. I came straight in here and I started cooking. And I wanted to jump on here for a few minutes, and I'm about to shower and I'm about to eat. I made some spaghetti. My daughter is back home. She's in college. I just went and picked her up this weekend from college. So now I'm back to being a mommy. I have not been a mommy since, well, y'all know I'm still a mommy, but she's been gone. She is home this weekend, but she had been gone. She came home like a few days for spring break, but before then I hadn't seen her for months. Like we have been going months at a time without seeing each other. So I've been somewhat of an empty nester. So now she's back home. So now I'm a mama again, y'all. I'm a mama. Jasmine said, enjoy your dinner. Thank you. When you oh guys, guess what I have coming? A lot of y'all been recommending medication videos. It's just a matter of me doing it on a slide and doing a video. But I have some of those coming up where we're going to be talking about the classification, the action, and all of that. But y'all been asking me to do videos on medications. So I will be doing it. I finally got it together. I started working on it, but it's just a matter of putting it on something so I can present it on here. So that's coming soon. Thank you. And happy Mother's Day to you and everybody else who's also a mom. All right, guys. All right, see you later, Tori. Thank you for the congratulations. You are so welcome. All right, guys, y'all have a good evening. I'm going to go ahead and end this for real now because I've been done said about 5 more times. Remember, manual blood pressures. If you struggle with it, get a blood pressure and stethoscope set and check at least 3 people a day. A day is even better, but at least 3 people a week, okay? Practice, practice, practice. I don't care if you have a machine and that's all of y'all use. That's all you guys use. Practice, practice, practice. Stop avoiding manual blood pressures. Yes, I got something on billing and on insurance. If you look on the channel, just look on the channel and then you'll find it. Yep, it's on here. All right, guys. Good night.